afternoon, and thank you for joining us. This briefing is to update you on the COVID-19 vaccine planning and is being aired live on YouTube. A reminder to maintain audio quality, to please remain muted until it's time to ask your question. If you're on the phone and are able to do so, please use *6 to mute and unmute. Joining us for today's media briefing are Department of Health Services Deputy Secretary Julie Willems Van Dyke and Stephanie Schauer, the Immunization Program Manager. We'll begin the briefing with remarks from DHS Deputy Secretary Julie Willems Van Dyke.
Well, thank you, Jennifer, and good afternoon, and thank you all for being here today. As was mentioned, I'm joined today by Stephanie Schauer, who co-leads the vaccine response as part of our COVID-19 response team. And we're looking forward to answering your questions about COVID-19 vaccine. There are a few key points I want everyone to keep in mind as we answer your questions today. First of all, distributing COVID-19 vaccine is the most significant public health undertaking of our lifetimes. It will require both preparedness and adaptability and patience. And here at the state level, we are prepared and also ready to make changes as needed to ensure safe and effective vaccine reaches Wisconsinites. A major part of that preparation has to do with our hub and spoke model for distribution. Once the Pfizer vaccine is approved, it will be sent in batches to hubs in each of our Healthcare Emergency Response Coalition regions, more commonly known as our HERC regions in our state, that are all equipped with ultra-cold storage this vaccine requires. Once at these hubs, vaccine will then be redistributed to smaller clinics around the hub area. The Moderna vaccine, when approved and available, will instead be distributed directly to vaccinators because it does not require that ultra-cold storage. So 2 different vaccines, 2 different storage and distribution strategies. As we prepare, we need you, the residents of Wisconsin, to prepare as well. Based on what we currently know about production, distribution, and delivery of vaccine, it will take a number of months to provide vaccine to everyone in Wisconsin. In the meantime, we all need to continue preventive measures like staying home, wearing a mask, physical distancing, and washing your hands frequently. And so we all need to be patient. We appreciate your patience because it means we'll be able to prioritize the populations who need COVID-19 vaccine the most right away to receive it first, including frontline healthcare workers and residents of long-term care facilities like nursing homes. Other high-risk groups will follow these initial groups, and then the general public will also be eligible. It will take time before enough Wisconsinites have received vaccine to make relaxing preventative measures safe, but we will get there. As the FDA and the Advisory Committee on Immunization Practice finish their review processes to ensure safety and efficacy, we at DHS continue to prepare and improve our distribution plan and stand ready to enact it. I'll bring this to a close by reminding you that if you are experiencing symptoms or have been exposed to COVID-19, please get tested. We all need to do our part to stop the spread, and that means staying home and wearing masks for every one of us. And for anyone with symptoms or exposure, it means staying home and getting a test. While we begin this line of effort for vaccine, we need to continue the line of effort for everything else we're doing to control the spread of COVID-19. So thank you. And with that, I will turn it over to Dr. Schauer.
Great. Thank you so much, Julie. My name is Dr. Stephanie Schauer, and I co-lead the vaccine response as part of the COVID-19 response team. I'm also the immunization program manager here in the Division of Public Health. I've been working in the immunization program at DHS for over 12 years, and previously I was with the Massachusetts Department of Public Health, and prior to that, a postdoctoral fellow at Harvard, where I worked after having received my graduate degree from Boston University. As Julie discussed in her remarks, COVID-19 vaccine distribution requires us to be prepared and adaptable. DHS has and will continue to work with stakeholders and partners in our communities in order to ensure the safe and equitable delivery of vaccine throughout the state. Part of our vaccine plan is to continue routine updates on the different phases through briefings like this one. We will also keep the information on our COVID-19 vaccine webpage updated. You can find that at dhs.wisconsin.gov/COVID-19/vaccine.htm. Thank you.
Thank you, and we'll now take your questions. A reminder to maintain audio quality. Please keep your phones on mute until it is time to ask your question. And we'll begin this afternoon with Mason Dowling from WAOW TV in Wausau. Mason? Again, Mason Dowling from WAOW. Okay, we'll move on then to Elise Romas from NBC 15 in Madison. Elise?
Can you hear me all right?
Yes, we can. Go ahead.
Wonderful. Thanks for holding this today. I'm just wondering, you talked about some of those hubs. We've heard from them, but how many hubs will there be throughout the state? You'd mentioned those regions, but just not how many there are. And how many vaccines will they be able to store?
There are a number of hubs throughout the state, and the number is, we are continuing to identify further hubs, and so we're not going to settle on a specific number at this point in time. And they also have varying storage for each of them. And again, I think that the key is we have adequate storage for the amount of vaccine that we are anticipating in the next few months. Dr. Schauer, anything you would add?
No, and I would just add is that remember that the hubs are only going to be used for the Pfizer vaccine, which has this particular storage challenge of the -80. As we move forward in the campaign, other vaccines will become available and won't require the hub and spoke model because those vaccines are stored at temperatures that are much more accommodating and easier to find in everyday offices.
Thank you, Elise. Now to Todd Richmond from the Associated Press. Todd? Again, Todd Richmond from AP. Okay, we'll move on then to Danny Maxwell from WKOW TV in Madison. Danny.
I'm wondering if you could talk about, when we talk about the different kinds of vaccines.
Hi, can you hear me? Hello?
Todd,
Hello?
hi. Hi, Todd.
Hello? Well, I don't know if you can hear me or not.
Okay,
Hello?
Danny, we're going to take.
Yeah, I'm still here. You can go.
Okay, Todd, go ahead with your question, please.
Hi, can you hear me?
Yes, Todd, we can hear you. Okay. Todd, we're going to have to move. Todd, we're going to have to move on because your audio quality isn't good. So we'll, Danny Maxwell from WKOW, could you please continue?
Yes, thank you. When we talk about the different types of vaccines, and I know a lot of them have different efficacies, but can you talk about the importance? We've heard, healthcare workers saying, it doesn't matter how effective it is and which one you get. It's just the importance of getting a vaccine. Would that be your advice as well?
Dr. Schauer, you want to take that?
Sure. So I think you're right. It is important. At this point, it's important to remember that we don't have a vaccine that's approved or licensed. I know the information is being reviewed by the FDA regarding their efficacy, and we will wait to see what those are. If initial information shows that they're roughly similar, although there could be differences. And we certainly will wait to see if ACIP would ever make a preference for one vaccine over the other. But at this point, we're really looking towards ensuring that folks have access to a vaccine and moving forward from there.
And I think what I would add is, I just want to reinforce what Dr. Schauer said is we do not yet have an approved vaccine. And the reason we don't is because the FDA is poring over all of the raw data from the pharmaceutical companies and reanalyzing it to assure that the reports we've seen to date are confirmed and that the vaccine appears to be safe. But the vaccines that we give today for a variety of diseases range in terms of their efficacy. And so I would definitely say to healthcare workers and to others who are considering this vaccine, any vaccine that is approved is going to have greater efficacy than simply sitting here exposed to COVID-19. And so it will definitely protect you better than not having any vaccine at all. And from what we've heard from the early reports, it's very encouraging, and we're hopeful that will be confirmed through the FDA scientific review process.
And thank you for your patience, Danny. Going on now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thank you for holding this. I was wondering, I saw a few weeks ago the UW system was offering some tuition credits for their students to help with vaccination. And it made me wonder if there was any concerns about having enough workforce to administer the vaccines to the millions of doses that are needed, and especially when the health system is already in crisis with COVID patients. Can you sort of elaborate? I mean, are there workforce concerns in getting this out there to people who need it? Thank you.
Great question, Sean. And so one of the things that we are doing at DHS is working on a contract for some additional vaccinators for this effort. Oftentimes, you are absolutely right. It is the healthcare system and local public health who are our workforce when we think about this kind of mass vaccination effort. And as you have so aptly pointed out, both our healthcare partners and our public health partners are deeply embroiled in responding to this epidemic at this point in time. So we are assessing across our healthcare systems who has capacity to be vaccinating their own. We've actually been pretty encouraged by that, by how many of our healthcare systems are saying, we have people to do vaccinating, and then assessing where additional workforce is necessary. And we will be, again, pulling from our assets that we're contracting for and others who are raising their hand and saying we are here to help, like UW. This is also another example of a cross-state government response. And so not only has our Division of Public Health been working on planning for the vaccine response, but we've been working closely with Wisconsin Emergency Management, with the Wisconsin National Guard. And so those are other assets that could be brought to assist with bolstering the vaccinator effort as we move forward. And then finally, I just want to remind people that this big bolus of people in the first phase in long-term care who will need vaccination, the federal government has contracted CVS and Walgreens to provide the vaccinators for those groups. So I think you can see this is a multifaceted approach to how we'll get vaccine out. And I hope that is a helpful answer to your question.
Thank you, Sean. Now to Shemaine Mills from Wisconsin Public Radio. Shemaine?
Thank you. Who will determine which healthcare workers get the first batch of vaccines, since there won't be enough for all the healthcare workers in the state?
So we have a couple of processes that will assist with that. One is our State Disaster Medical Advisory Committee, or SDMAC, is making recommendations about within healthcare how you may triage who gets vaccine first. And then secondly, we also know there's just some pragmatic issues that we'll address who gets vaccine first in this first round because of the cold storage requirements of the Pfizer vaccine. So there may be times where we are doing a group of healthcare workers because they are there and readily available and the vaccine is thawed and we need to give it to 1,000 people at a time. And so it'll be both thinking about who is most at risk and targeting those folks first, and how do we make sure we don't waste a single dose of vaccine as we move forward doing that. Dr. Schauer, what else would you add in the terms of prioritization?
Yeah, and I think a lot of this has been also considerations for within an institution has been made by that SDMAC group that Julie is speaking about. And things that they might consider are individuals who work in COVID-19 units or the ICU, or those who are performing sort of high-risk procedures like aerosolization, et cetera. And so there is guidance that was put out for public comment. I believe it closed on Friday, not only about the healthcare definition, but then the guidance and information about how to make those really tough decisions when the number of doses doesn't sort of meet the need within a given institution.
Doesn't meet the need
yet. Correct.
Because it is coming, and we'll have much more vaccine coming in subsequent weeks.
Thank you, Shemaine. Now to Stephanie Hoff from WIS Politics. Stephanie?
Hi, good afternoon, and thanks for taking my call. I'm just looking for how many doses the state is going to get, and also, are these the doses that will have to that will require 2 doses per person? So, if the state were to get 200,000 doses, would it only vaccinate 100,000 healthcare workers? So, just looking for some figures there. Thank you.
Dr. Schauer, you want to talk about what we're expecting?
Sure. So the first allocation to Wisconsin will be the Pfizer vaccine, and we will be getting 49,725 doses. And those are first doses. The way that CDC is doing it is that they are giving us allocation 1, and they will keep back the amount for dose 2. So they will have another 49,725 doses ready for us when it's time to for folks to receive that second dose. So we don't need to split that. That is something that the federal government is doing with all allocations.
Thank you, Stephanie. Now to Ben Jordan from WTMJ in Milwaukee. Ben?
Hi there. Thanks for taking my question. I know there are a lot of variables in terms of when the FDA is going to approve both vaccines. Do you have an estimate in terms of how long it's going to take to get all of the healthcare workers and long-term care people vaccinated, the 450,000, before you start getting to the high risk and general population?
Yeah, and this is going to be dependent on a couple of things. Certainly when the authorization is issued. Secondly, when we're able to start vaccinating. And third, you heard Dr. Schauer highlight how much vaccine we'll have in the first week, and then it will depend on how quickly we start receiving additional vaccine. And that's the piece that's hardest to get to a really specific target for your question about how long this phase 1A will last. But I'm anticipating it will at least take a couple of months for us to get the first dose to everyone. And then remember, the first dose is only the first dose. And then everybody we immunize needs to have a second dose with the Pfizer vaccine 3 weeks later and the Moderna vaccine 4 weeks later. So even if we got everybody their first dose in the next couple of months, we wouldn't be done giving them their series for at least 3 months. So this is why we say this. We're asking for patience, and this is going to take time, and it's going to be a process moving it forward.
Thank you, Ben. Now to Katie Thorson from WXPR Public Radio in Rhinelander. Katie.
Hi, thanks for taking the call. I was curious if you've heard about with these vaccines. I know there's some that if people with certain conditions or allergies, they can't have certain types of vaccines. Are you hearing anything with these ones that are waiting to be approved of people that may not be able to get them because of medical reasons?
Well, I know that's an important part of what we are waiting for with the final recommendations from ACIP. Dr. Schauer, do you have any preview on these vaccines?
I don't. I think the one group that people are most, thinking about is pregnant women. There has been some interim guidance issued by ACIP, but really, as Julie said, we're waiting to hear. That's the clinical guidance that is so crucial for vaccinators to have that information in hand so we know who should be receiving the vaccine and who shouldn't. So that'll be a challenge, or that is a charge to ACIP to go ahead and provide that information, which will then be published in the MMWR report.
Thank you, Katie. Now to Cassie Greenwood from the Dodgeville Chronicle. Cassie. Again, Cassie Greenwood from the Dodgeville Chronicle. Okay, we have to move on then to Brittany Schmidt from WBAY TV in Green Bay. Brittany? Again, Brittany Schmidt from WBAY. Okay, we'll move on then to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, earlier you guys talked about...
Go ahead, Madeline.
Okay, sorry. Earlier you guys talked about SDMAC, the State Disaster Medical Advisory Committee. When you guys met, or when that committee met, I saw that they discussed different recommendations in terms of how the state would weight different vaccinating entities in terms of how many doses they could get. So for example, it talked about higher levels of social vulnerability and how that would get priority, or vaccinating entities that would plan to vaccinate first responders. Could you just talk about some of those recommendations from SDMAC, maybe specifically the two that I just mentioned, or other ones that you think are important?
Absolutely. I want to cite that SDMAC is a committee that is populated by Wisconsin health professionals who have volunteered for this role, and they're great public servants, and they are all esteemed healthcare professionals from a variety of different specialties and settings across the state and disciplines. They have been providing counsel to us throughout the pandemic, and their role is really to help provide us counsel on how to distribute limited resources. So they've done this. They gave us guidance on how to distribute PPE back in the beginning of the pandemic. They've given us great guidance as some of the therapeutics have become available, like remdesivir and the monoclonal antibodies, and now moving into vaccine. And so, so question one is, when we get 49,000 doses, where in the state do we distribute them? Do we just, you know, divide up by 72 counties? Do we divide by population? Do we use burden of disease or other considerations? And so they are recommending a combination of population and an index that CDC has created called the Social Vulnerability Index that modifies a pure population distribution by thinking about the kinds of things that put certain populations at greater risk for disease. Things like poverty and economics, and for this disease, congregate settings and density of housing, how many people are living per house, and so a variety of different social determinants of health. And that helps us direct the total number of vaccines to the communities that are most at risk for that. So that's the first layer. Then the second layer is what we were speaking about earlier, about who within health systems may be at risk, and how are you going to distribute the vaccine. And so some of their recommendations were also not just, they included things that Dr. Schauer mentioned earlier, like the risk to the healthcare workers within those systems, but they also looked at attributes of the systems and whether they would have the ability to be able to distribute vaccine to other people, other healthcare workers who are at risk, like emergency medical services providers, or those who might not have as easy a way to distribute vaccine within their own smaller group of healthcare workers. So that certainly was one of the considerations. SDMAC makes, the AC is advisory committee, and they make recommendations to the secretary. And so we'll be looking forward to receiving their final recommendations within the next week or two. Dr. Schauer, anything I missed that you would add on?
No, I think you got it. Thank you.
Okay, great.
And thank you, Madeline. And I just want to remind you to use *6 to mute and unmute your phones. And if we call on you and you're not readily available, we do have to move on, but we'll try to get to your questions later on. And with that, we move on to Sierra Trojan from Fox 11 in Green Bay. Sierra?
Hi, thanks for doing this call today. When the time comes, how do you plan to notify people who are, say, high risk and sitting at home that they can get the vaccine and how they can get it?
That's a great question, and part of our ongoing planning that we will be doing. One of the ways we'll do that is through all of you. And as we both said here today, we continue to plan to do regular media avails so that you can help us in getting that information out to folks as vaccine becomes available. And I think another approach that we will certainly be thinking about and working with our healthcare partners and our partners in the electronic health record industry like Epic is what kind of notifications we can do to people through their own electronic medical record, through mechanisms like My Chart that could, you know, every fall comes and I get a text and an email from my healthcare provider saying it's time for my influenza vaccine. And so as the groups expand, we could work with our colleagues at Epic and healthcare systems to incorporate that kind of individualized notification to people as well. Dr. Schauer, other things the group is thinking about as we're planning?
Yeah, no, I think that's those are all, you know, certainly the communication piece is an important piece. I would also add that one of the important parts of the vaccine that we're seeing is, as you mentioned, these are 2-dose series, and it's going to be important not only for folks to recognize when they are eligible for their first dose, but to remember to return for their second dose on time. And so to that effect, I know a lot of different strategies will be employed at vaccination clinics, but one way that they can also, or individuals can look up their own record in the Wisconsin Immunization Registry and see which vaccine they've received and when it's recommended that they go back for that second dose, and make sure that they have a plan, if not already an appointment, to go ahead and get that done.
Thank you, Sierra. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yes, hello. Thanks for taking my question. We've heard a lot about how this vaccine is going to be distributed and to whom, specifically the healthcare workers and then people in long-term care facilities, but we haven't really heard of much outside of that. After that is completed, will there be any sort of a rationing of any sort of vaccine? We've talked to some experts who believe that there, it may be some people who are, members of certain minority groups who get it before the majority of the population due to certain health concerns, so on and so forth. Is there anyone who's set up to receive the vaccine next after people in long-term care facilities, or are we kind of expecting maybe some people with some certain health conditions, certain groups to get it immediately afterwards? Thank you.
Great question, and part of what all of us who are executing this strategy, both planning and implementing at the same time, are thinking about as well, Ron. So again, ACIP, the Advisory Committee on Immunization Practice, will be looking at who the next tiers would be to receive vaccine. I understand they will be, after they've issued their guidance, their final guidance, after the FDA EUA is issued for the Pfizer and or Moderna vaccine, they'll be getting on that pretty quickly. There are three groups that have largely been discussed, and they're pretty broad categories. It's other essential workers. Certainly healthcare workers are a big component of essential workers, but other essential workers, people over the age of 65, we know the older you are, the more at risk you are for this vaccine, and then people with other comorbidities, such as asthma, heart disease, diabetes, other things that put them at risk for more severe disease. So those are three large groups that ACIP may be considering, and there may be others as well. But those discussions are yet to happen, and we do anticipate that phase 1B, 1C, and phase 2 will continue to have some level of distinction of who should be first in line before we move to opening up the vaccine for the broad general public.
Thank you, Rob. Now to Griselda Perez from Spectrum News. Griselda. And a reminder to use *6 to unmute your phone. Once again, Griselda Perez from Spectrum News. Okay, moving on then to Denise Lockwood from Racine County I. Denise?
Hi, my question is, are these vaccines live? What are the potential side effects? And how long are they expected to be good for? How long do they last?
Dr. Schauer?
Yeah, sure. So these vaccines, the Pfizer vaccine and the Moderna vaccine, are being made with a newer technology. It's an mRNA technology. So it isn't a live vaccine, nor an inactivated. It's actually contains just a small part of the spike of COVID-19 or of the coronavirus, and that is used to generate an immune response. So it's just a tiny part of one piece of the virus that is in there. I think we don't know how long immunity will last, whether you get one series and you'll be done. And that is something that they are going ahead and studying, whether we can do the 2 doses and be done with it, or whether it would be something like the flu vaccine. So more information is coming with respect to that.
Thank you, Denise. Now to Ryan Urban from the Barron News Shield. Ryan? Once again, Ryan Urban from the Barron News Shield. Moving on then to Sophie Carson from USA Today Network, Wisconsin. Sophie.
Hi there. My question is, do you still expect to get the 49,000 doses in the week of December 14th? And have you heard back from the federal government on whether Wisconsin will be prioritized and get more doses after Governor Evers' letters last week asking about that?
Dr. Schauer, what do you know about what we expect to get?
Yeah, so we have the initial allocation for Pfizer, and we have and we have projections, but we, I think it's important to note that we anticipate receiving vaccine on a regular basis. We don't know the amounts, and right now it's my understanding that CDC is using a formula based on population to go ahead and divide up the number of doses to the individual states and jurisdictions.
Thank you, Sophie. Now to Brennan Scarborough from WSAW-TV in Wausau. Brennan?
Hi, thank you for taking my call. Was just wondering, you guys talked a little bit about once the vaccine kind of gets spread out and starts to get distributed, we're able to ease off on some of the other, masking and the other things that we have in place as well, the social distancing. When do you all expect that to be kind of, to go a little lax on those regulations?
Well, Brennan, that is a fabulous question, and I wish my crystal ball wasn't quite as foggy today so that I could answer it more specifically. But I think it helps to stop for a moment and think about what we're striving to achieve here. So there are 5.8 million people in Wisconsin. Let's say everyone raises their hand and says, I'd like to get a vaccine. That's it's 11.6 million doses that we have to give out. And so, to date, when we think about how many COVID-19 tests we've done, overall, we've done around 4.5 to 5 million tests since last May. So just think about that scope. It's not like you can give that many vaccines in a month or two. This is going to spread over at least a similar period of time as our testing effort has to date, and probably a little longer. So, we're looking into mid to late 2021, I think is a really realistic goal for us to be thinking about. So I know everybody's excited and we'd love to take our masks off by Valentine's Day, but that's just not going to happen. It's going to be later in 2021. So, the best I can give you is sometime in 2021. And I think we should all be thinking, more towards second, third quarter, which is what the CDC director said several months ago. I think that is a good estimate, thinking more towards the summer, early fall. Dr. Schauer, do you have is your crystal ball any clearer today?
I'm afraid it's still cloudy, and I think it just reiterates the importance of continuing to wear masks, social distance, and do all of those things that we know are helping. And vaccine is going to be another layer onto that going forward.
Thank you, Brennan. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you very much. My question is about public receptiveness and what confidence or concerns either of you have about the interest in and willingness to get the vaccine, and the basis for your outlook in this regard. I guess both what you're anticipating in terms of pro but also anti-vaccine sentiment out in the public once it does move to the general population. Thank you.
Dr. Schauer, would you like to respond to that first?
Yeah, I think it's important to note that people have questions about vaccines in general, and that's important to ask those questions, and so that people feel reassured. So we are trying to provide as much information as possible. I think when you look at the process that is happening with the FDA review and the ACIP, trying to be as clear and transparent and reassure people the processes are in place, that we have a safe and effective vaccine, and that both of those pieces really need to be in place for that approval. Going forward, these vaccines will continue to be studied in both of those areas, and I hope that that information will help reassure the public about them. Julie, anything to add?
Yeah, I think that's spot on. And I think the other thing that I would add is, Eric, if you've seen my inbox or Secretary Palm's inbox lately, it's very encouraging. There are many, many groups contacting us, asking to be next in line for the vaccine. And so many people that are really excited about this opportunity and want this kind of protection. And, I think it's like anything. I remember when the iPhone came out and there were the first people who had to have an iPhone. And then there were people like me who were like, I don't know about that thing. Let me see how it goes for other people. And I'll get in, third or fourth in line to see how it goes. And, so I think it's like any new technology or new approach to healthcare. There'll be the early adopters, and then there will be those who will see how it goes with those early adopters, and others who will come along. So we're confident that a good share of Wisconsinites will find this an effective way to bring us to the other side of COVID-19.
Thank you, Eric. Now to McKenna Alexander from WQOW-TV in Eau Claire. McKenna?
Hi, thanks for taking my call. My question is, given that schools can require students to be vaccinated, will it be a similar approach as far as workforces? Will employers be able to require employees to get the vaccine? Thank you.
Yeah, I think employers will be considering a number of different ways to encourage their employees to get vaccine. This is the EUA will have guidance around consent and under what conditions the vaccine will be given. And so we'll wait for more information on that. But employers may have ways to really encourage their employees to get vaccines or to incentivize them to get vaccine. We'll see how that plays out. Dr. Schauer, anything you'd add to that?
Yeah, no, I think we're just waiting to see. Thank you.
Thank you, McKenna. Now to Emily Files from Milwaukee Public Radio. Emily?
Hi. So my understanding is the Pfizer vaccine could be approved as early as this week. Correct me if I'm wrong, but if that does happen, when will those first 50,000 doses be, when will those vaccinations begin in Wisconsin?
So again, it depends on when FDA would issue their emergency use authorization. Then there are several other steps before we'll actually see shots in arms. The Advisory Committee on Immunization Practice will meet, will make their final recommendations. Those final recommendations will be published in a publication called the Morbidity and Mortality Weekly Report, or MMWR. And it is then that vaccinators would have the information they need to understand dosing and side effects and all of the clinical guidance around who should or should not receive the vaccine. So we will be working with CDC to get appropriate education materials out to vaccinators, appropriate consent forms, appropriate patient education materials, and then we would start vaccinating. So we're going to expedite all of that process once the EUA and the ACIP has published their recommendations, and work to get that turned around very quickly. So that's the process. Dr. Schauer, anything you would say about between EUA authorization and when we'll first be giving vaccines?
Yeah, I think many are eager to get the vaccination program underway, but I think it's important to make sure that it's done in a well-planned, careful manner and that safety is not compromised at the expense of speed. So we certainly understand the wanting to move things along, and we'll do what we can, but we need to make sure that it's done safely and correctly, and all of the information is there for vaccinators and vaccinees prior to starting.
Thank you, Emily. Now to Bram Sable-Smith from Wisconsin Watch. Bram.
Hey, thanks for taking my call. You touched on this a little bit earlier, but I want to ask you a little bit more about some of the uncertainties of these vaccines. So what can you tell us about what we do or do not know about their effectiveness against transmission, and also their safety for pregnant women, nursing mothers, and children? And how much does that uncertainty matter for the public health effort that that you're directing here in the state?
Dr. Schauer, you want to take a first crack at that, and then I'll follow up?
Sure. I think you're right. There are still some areas where we will not see an ACIP recommendation, perhaps start with, particularly one is with children. Is there, wasn't or isn't sufficient data at this time that we don't anticipate that there will be a recommendation for children, and that we'll see that come along as more data comes. And so I think that's one area that, as well as individuals with immunocompromising conditions. We talked about the use in pregnancy and will there be sufficient data. So I think there are some areas, some will be addressed by ACIP and some they're going to say, we don't have enough data to go ahead and recommend the vaccine for this particular group. So I think, and that will be vaccine by vaccine specific.
And then what I would add to that is in terms of side effects, again, this is if FDA issues an emergency use authorization and then passes that on to the Advisory Committee on Immunization Practice, they will provide further detail about side effects of the vaccine. And, for example, what percentage of people who receive the vaccine experience certain side effects. It would not be uncommon that this vaccine will have side effects similar to other similar vaccines. Part of what happens when you put a vaccine into your body to stimulate an immune response is your immune response can create some side effects that aren't always pleasant. They're not harmful, but they're, things like headache, muscle aches, pain at the injection site, fatigue. And so those are signs and symptoms of the body producing antibody to protect yourself. And as I often said to parents when I was immunizing their babies, actually a little irritability and a fever is a good thing because that is showing your child is actually reacting to the vaccine and producing the effect we want it to have. So we fully anticipate that the vaccines will have some of those side effects, and we'll have more detail about which ones and the frequency after these important analyses and documents are released.
Thank you, Bram. Now to Hannah Fraser-Champong from CBS News. Hannah?
Hi there. Thank you so much. My question is about distribution of vaccine to rural areas. Do you have any sense for a breakdown between how it will be distributed between urban, suburban, rural areas? Have you determined that?
Yeah, we're really committed to making sure there is vaccine accessible across our state. And so a number of the hubs are in more rural areas than the urban centers of Southeast Wisconsin and Dane County and the Fox Valley. So we do have hubs for the Pfizer vaccine and a good part of the state that can be reached from each of those hubs. And then again, just want to emphasize our anticipated arrival of the Moderna vaccine shortly after we begin to receive the Pfizer vaccine, which will also make access for rural communities much easier because we'll be able to ship the vaccine directly to the clinic in Mercer or Rhinelander or Hayward, many of the places that are very rural in our state.
Thank you, Hannah. Now to Nick Bohr from WISN TV in Milwaukee. Nick? WISN? Okay, we'll have to move on then to Kim Shine from CBS 58 in Milwaukee. Kim. CBS 58. Okay, moving on then to Tyler Job from WKBT TV in La Crosse. Tyler.
Yeah, thanks for taking my call. So I have a two-part question. So I want to focus on the people that are below the age of 65 and are healthy. So when are those people expected to get vaccinated? And when that time comes, will there be a cost for those people to pay for that vaccine? Thanks.
Yeah, those folks, fairly low risk folks for the disease, so that's why they'll be towards the end of the prioritization of vaccine, will come after the priority groups we've described so far. And again, the timeline for that is a little hard to predict, again, because of all the factors we've mentioned. But I would guess, you know, moving it towards the summer months. The cost is a great question. And so there is federal legislation that will require insurance companies to pay for this vaccine, just like many of our other vaccines are required to be covered by our insurance. And so for those parties who have insurance, most of our vaccinators, either in the healthcare system or in the community-based clinics, will be setting up after we get through these initial groups to get at that broader population. It is our intent to be billing your insurance for that vaccine as well. And that's a preventive measure, and so there are, under the majority of plans, there is no copay or deductible associated with that. If people do not have insurance, we will assure that the administration fee for the vaccine is covered through our state network. And when I'm talking about billing insurance, I want to be very clear. I'm only talking about the administration fee for the vaccine, because the vaccine itself has been purchased by the federal government and will be provided to states free of charge.
Thank you, Tyler. Now to Joe States from WORT Radio in Madison. Joe.
Hi, thank you very much. My question, I believe you touched on this before, but is there any worry from the DHS that there's going to be sort of an informal easing of restrictions as people do not consider it a danger anymore?
Well, I'm not going to go to worry. I'm going to go to, we need to all continue to link arms as we have throughout this pandemic and help each other understand what is necessary until we get to a sufficient level of vaccination to have appropriate protection to ease those restrictions. So, you know, in the early days, when we're in phase 1A, like we are now with healthcare workers and long-term care workers, we should not be thinking that anybody's been vaccinated. That's a small enough portion of the population. You know, that's only going to be 10 to 15% of our state if every healthcare worker and everybody in a long-term care facility got vaccinated. And that's not enough to have the kind of protection we need to move forward. So we need to just all be patient, keep focusing on for a good part of 2021. We need to continue to keep our masks on when we're outside of our home, to keep social distancing, to keep our social circles smaller. You know, the good news is as we come out into spring, once again, just as we did last year, we'll be in a better position to see each other outside, which is a much safer place. We all need to work together just to keep the good protective measures in place as we get this vaccine out. And then as we measure and see the effectiveness of the vaccine and see the uptake of the vaccine, slowly begin to dial some of those measures back.
Thank you, Joe. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell.
Yeah, thank you very much for the call today. I was curious, you know, you kind of talked a little bit about kind of reaching that point of educating people on the vaccine, the importance of that. But obviously, as has been mentioned, there's obviously going to be a number of people who may not want to get that. I'm just curious if you could talk a little bit about if there's any sort of a public health concern for the population that chooses not to get that vaccine, or if that has any other ramifications that may not be known. And then just piggybacking on that, could you talk a little bit about how the state plans to keep track of who has had how many doses of the vaccine? Thank you.
Well, these are great questions for Dr. Schauer.
Yeah, so one of the key tools that we will be using to keep track of doses that individuals have received is the Wisconsin Immunization Registry. This is a statewide registry that's been in use here in Wisconsin for over 20 years and has the records of and receives information from healthcare providers, local health departments, et cetera, so that an individual, no matter where they're vaccinated, can have all their immunizations in one place. And we're going to use this existing infrastructure to collect and record the COVID-19 vaccines. So once again, a healthcare provider can see if someone's received a vaccine and if they need their second dose and which type of dose they need. We haven't talked about it today, but it is important that the doses match. So the kind that you get for the first dose is going to needs to be the same kind that you get for the second dose. And so the Wisconsin Immunization Registry will be a great tool both for healthcare providers as well as for individuals to know what they had and when they're due for their next one. And Julie, there was a second part of the question.
People who don't receive the vaccine, what are our concerns about them?
Yeah, I mean, I think certainly we want to protect as many people as we can. That's important. And thinking about those who perhaps may not be able to be vaccinated, we want to encircle and really increase the number of people around them protected. So I think really continuing to work and answer people's questions and make sure that they have the information they need to have an informed decision and feel confident about moving forward and getting vaccinated.
I think one thing I'd add to that is we've also had a number of questions about if I've had COVID, should I get the vaccine? And our recommendation would be yes. Again, as we've said throughout this pandemic, we do not know how long the actual infection itself may confer immunity. And so getting the vaccine is a good idea for people even who have had COVID infection to assure longer term immunity and protection for themselves.
Thank you, Mitchell. And we are coming up on 3 o'clock, but we still have a list of reporters to go. So please keep your questions short as we move along here. And we'll go to Lane Kimball from WISC TV News 3 Now in Madison. Lane? Again, Lane Kimball from WISC. Okay, moving on then to Angelica Lavito from Bloomberg News. Angelica.
Hello, thank you for taking my question. I wanted to ask, so I was looking at the numbers, the estimates provided about the number of doses the state plans to have in that first allocation, and it looks like there will be more Pfizer vaccine doses available than Moderna, and I'm wondering why that is. If the federal government is saying there will be more of the Moderna available than there will be for the Pfizer vaccine.
Dr. Schauer, what do you know about vaccine allocations?
Yeah, and I think, it's similar types of formula, but each manufacturer has been manufacturing for different lengths of time and depending on when and if the EUA is approved. So we do expect that we will get a certain percentage that is set by the federal government. And as I said, it basically is dependent on population, but that we hope as time goes by and as we get into the new year, assuming both vaccines have been approved, that we will continue to see our allocations rise over time. And so that we'll be moving up from there.
Thank you, Angelica. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Hi, guys. Can you hear me?
Yes, we can.
Awesome. For the Pfizer vaccine, who are the hubs that will then distribute the vaccine to vaccinators? Are they hospitals, or who actually has this the super cold storage that can actually hold on to these vaccines?
There's a variety of entities across the state that have met this criteria, and many of them, yes, are healthcare systems.
Thank you, Adam. Now to WXOW TV in La Crosse. WXOW. Once more, WXOW TV in La Crosse. Okay, now we're going to try to go back to those we tried to get to earlier, and that includes Todd Richmond from the Associated Press. Todd, are you with us?
Hello, can you hear me?
Yes, we can.
Two-part question. Are the 50,000 Pfizer doses that you anticipate already here in the state? Second question is, given all the administrative steps that Julie just outlined a little bit ago, how realistic is it that we're going to see the first shots before like March or April? Is that a more realistic time frame when we can expect those first doses? Thank you.
No, there is not vaccine in the state yet, and we will certainly be giving, I'm sorry if I made it sound that onerous. We will certainly be giving doses long before March or April. I anticipate we'll be giving doses in December. It's just what date in December we don't yet know.
Thank you, Todd. Now Griselda Perez from Spectrum. Griselda. Brittany Schmidt from WBAY in Green Bay. Brittany, are you there?
Hi, my question is, so I know that you kind of talked a little bit about the vaccine and how technically the vaccine itself is free from the federal government, but I was doing a story just about scams surrounding the vaccine and just reminding people just to be patient, that you can't just buy this over the internet. Nobody's going to call you saying, hey, come get your vaccine. Can you talk a little bit more about that, that this is going to be, I mean, you already talked about it's kind of under lock and key.
Yes, yes, and we've certainly seen plenty of scams throughout COVID-19, and I would just re-emphasize that the parties that will be administering this vaccine are going to be your healthcare providers. That is going to be the biggest source of vaccine for folks, just like if you're going to get a tetanus shot or a flu shot. And while we're saying flu shot, let's remind everybody it's still flu season, and we encourage you to get a flu shot if you have not already received one. But healthcare providers will be the most common place that you'll have access to COVID vaccine as we move along. And then because we have so many people that we want to get vaccinated quickly, similarly, as we think about COVID testing, most of our COVID testing for disease is done in healthcare settings. But again, because so many people needed tests that our healthcare system was not large enough to do all those tests, we've supplemented it with community-based testing. And so as we move along, as more vaccine is available and more populations are eligible, we'll be moving into community-based vaccination clinics. And so to know that those are on the straight and narrow, we'll be setting up websites on the DHS website and letting people know where community-based vaccination clinics are, just like we have with community testing. But please don't take a call or respond to something that says, I got a COVID vaccine and I can mail it to you, because that's not how it's going to go. Thank you for raising that important issue. Jennifer, you might be on mute.
All right, it sounds like Jennifer's having an issue. Apologies for that. We will try to, I think we have one more reporter that we want to try to get to that was not available when we first called on them. Griselda Perez, Spectrum News. Griselda, are you there? Nick Bohr, WISN in Milwaukee. Nick Bohr. How about Kim Shine from CBS 58? Kim Shine? All right, well, with that, we will wrap up today's briefing. We want to thank Deputy Secretary Julie Willems Van Dyke and Dr. Schauer and everyone else for participating. Please continue to monitor the DHS COVID-19 web pages for data and guidance, and additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.